Safe supply, it is the be all and end all for some in the drug and harm reduction movement. For others, it is a dangerous precedent that needs to be stopped. Hi, I'm Brian Lilley, political columnist for the Toronto Sun. We've been arguing about the issue of safe supply for some time now with quote unquote experts saying this is safe, this is good, this is what we need to do to keep people alive. And no, don't worry about the idea that these pills are being sold on the black market, trafficked in our streets, sold to kids. It's not happening. Well, now we know the truth. They were lying. They were not telling the truth. They were turning a blind eye. Say what you will. London police held a news conference recently where they spoke about tens of thousands of opioid pills, hydromorphine, dillies as they're known on the streets, being trafficked in the streets of London, but across Ontario as far north as Thunder Bay. Joining me now to discuss this is Adam Zivo. He is the executive director and founder of the Center for Responsible Drug Policy. And of course, you read him in the pages of the Toronto Sun and National Post. Adam, thanks for the time.
Thank you for having me on the show again.
I know that you broke the story. You were about 2 weeks before London had this, but how did you come across this? Because you and I have talked to people who have said, safe supply diversion is happening. And that's when someone gets a prescription for an opioid pill, and then they turn around and they sell it so they can buy fentanyl or something else. And then those pills are in turn sold to kids on the street, other addicts, trafficked in other jurisdictions. We've been talking about safe supply diversion for some time. You've led the charge on it. And all along the way, we've been told it's not happening. You have no evidence. No evidence, nothing to see here. It's like Baghdad Bob, but on drugs. And now we've got the evidence. How did you come across this?
Well, so I've been aware of the fact that safe supply diversion is a huge problem in London for about a year and a half. And I first became aware of this in January or February of 2023 when I spoke with Dr. Sharon Kivu, who's an addiction physician who works in London. And she spoke at length about how her patients were telling her that diversion was ubiquitous and that she was seeing younger and younger patients come in who had developed an opiate addiction due to diverted hydromorphone. That is the drug that is dispensed through safer supply predominantly, and it's as strong as heroin. So in the autumn of 2023, Koivu conducted a chart review of 200 patients that were admitted through her addiction services program. So between January and June of 2023. And of those 200 patients, she discovered that 1/3 of them who were not enrolled in a safer supply program self-reported accessing diverted hydromorphone. And in an overwhelming majority of cases, they said that they were getting their hydromorphone through safer supply patients, right? That it was diverted from safer supply.
Yeah.
So in December and January, I began to more proactively investigate diversion within London, Ontario, and I spoke with over 15 people at this point who confirmed the fact that diversion is ubiquitous.
And this included, I believe it was the head of the London Police Union, who I'd been hearing from his frontline members.
Yeah, so there was Paulo Dominguez, and he said that frontline police officers working in downtown London knew as a fact that diversion was happening everywhere. It was common knowledge. And around this time, I had heard through a credible source that the London Police Service was aware of the fact that diversion is a huge issue, that leadership was concerned about it to a certain degree, but that they didn't want to go public about the issue because they were concerned about potential backlash from public service agencies, particularly those that work in addiction and homelessness. And that was concerning. You never want to hear that police leaders are potentially withholding information from the public that is relevant to public safety.
And for very political reasons, it would seem.
Yes, so I sat on this information for a bit as I continued to do my investigation. And then in early April, I saw that there was a major drug bust announced in London. And that bust included a number of drugs, including about 10,000 Dilaudid pills. Dilaudid is the brand name for hydromorphone. And when you see that number of pills in one heist, it's almost guaranteed that there is a connection to safer supply. So I sent an email. I included a list of questions asking about the bust, asking if there was a connection to safer supply, and asking for the London Police Service's overall thoughts on safer supply diversion. And to preemptively block them from obscuring, or I guess like deflecting, I included the fact that I knew that frontline officers said this was a problem. I included the fact that I knew from a high-level government official that large amounts of safer supply are being trafficked from London to northern communities in Ontario. So I thought this would prevent them from obfuscating, but they basically just didn't respond to me for 3 weeks. Yeah.
Government officials love to obfuscate. They love to not release information. Uh, Transparency is not in their nature. So you eventually get confirmation, or you get in touch with London police, and it still took them weeks to after that to acknowledge that this was an issue and that things were being done for political reasons.
Well, what I want to stress is that they seemed reluctant to answer my questions until I put them in a position where it was impossible for them not to. So they didn't respond to me for 3 weeks, and then I sent an email asking them for a clear timeline and expressing concern that I was being stonewalled, and that was very strategic. And of course, the next business day, I received a call from Paul Bastien, who is the deputy chief, and he said, no, 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 we're not stonewalling you. And from that conversation, I was expecting to receive data from him measuring the scale of the safer supply diversion crisis in London. So I waited and waited and waited. And after about a month, there was nothing. And the communication seemed to drop off. And so I decided to apply pressure again by sending an email and telling them that I was going to write a column about diversion in London and the London Police Service's response to it, or lack thereof. And that column was going to come out the following week, regardless if they answered my questions or not. And I gave them a deadline, Friday, 5 p.m., to answer my questions. And so Friday, 4 p.m., I received an email where the London Police Service confirmed that safer supply diversion did seem to be a significant problem, that heist did seem to be connected to safer supply, and they gave some very interesting data. So they confirmed that hydromorphone seizures had exploded by 3,000% since access to safer supply was widely expanded in 2020, whereas in 2019, about 850 pills were seized. By last year, that number had gone to 30,000. And to give listeners a context of what this means, just 3 of these pills is enough to induce an overdose in a new user if snorted. So these 30,000 pills are the equivalent of 10,000 overdoses for teenagers.
So, and these are supposed to be taken orally, but I remember my own interview with Dr. Koivu, who you mentioned earlier, and she said people were either crushing them to snort them, or crushing them and boiling them up in the spoon and injecting them like you do with heroin, and that this was leading to all kinds of um, medical conditions, malformities. So you've got a doctor saying this, you've got the police knowing this is going on, and everyone is just burying their heads in trying to pretend that this isn't going on.
Well, that's the thing, is that Koivu was not burying her head, and other physicians in London were not burying their heads. They were speaking out about this. Koivu has been talking about safer supply diversion for years, but she has been gaslit consistently. She's been told that she is lying, that she is exaggerating, that she is fear-mongering, and all the while, the London Police Service had access to data showing that her concerns were true. And in fact, I realized when I received this data that I had been stonewalled when I first reached out to the London police back in April of 2023. I asked them if they had any insights about diversion, and they said that they had no one who could speak on the issue. But at that time, they already had data showing that hydromorphone seizures had increased 6-fold. So I got this information at the beginning of June, and I was going to report on it, but then they said that they would be able to more freely talk about this at the end of the month. And I took that to mean potentially that there was some operation going on. And so, out of an abundance of caution, I postponed my column, uh, and then reached out to them at the end of June, asked them if there were any operational considerations for me publishing. They said no. And that's when that story came out, which seemed to finally press them to come public about the results of their investigations and to finally admit to the public that safer supply diversion has been rather disastrous.
So you've got 30,000 pills being seized. As you say, that's enough for 10,000 overdoses. Those are just the ones being seized, Adam. How many more are being consumed? My guess is tens and tens of thousands more. When someone gets a so-called safe supply or safer supply prescription, they're not just getting a pill or two. They're getting dozens a day, aren't they?
Yep, I mean, it depends on which province you're in. So, Dr. Mark Mallett, in an op-ed for the Globe and Mail last autumn, estimated that millions of safer supply pills are being distributed every year. For a safer supply patient in Ontario, they can get up to 30 or 48 8 milligram pills. In BC, the limit is technically 14 pills, but sometimes people go beyond that.
That's per day.
Per day, every single day. And here's
Wow.
let's put the context here. So if you are being treated for acute pain, if you have just come out of surgery, you're receiving 2 milligrams every 4 to 6 hours, so maybe a max of 12 milligrams a day. If you have severe arthritis, you are getting 12 milligrams a day. If you are in late stage cancer and on the verge of death, maybe you're getting about 100 milligrams a day. So the average safer supply patient in Ontario is receiving 20 to 30 times more hydromorphone per day than the average acute pain patient or the average chronic pain patient.
Right. So here's my problem. Safe supply exists because the Trudeau government bought into this. And I know people are screaming at me right now and they're saying, no, 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 no. This sort of thing, this is a provincial. And I know you've got thoughts on the province's role in this, various provincial roles, but this program only exists because the Trudeau government bought into it and they have offered select places exemptions from federal drug laws. And that's how this is able to go ahead. They have no interest in pulling back on this because they are true believers in this. They believe that this is saving lives. And yet, since this came in, British Columbia has not seen a reduction in overdose deaths.
Mhm.
We've got it here in Toronto, we've got it in London, Ontario. I believe Ottawa has a location or two doing safe supply. We're not seeing a reduction either. So, what does success look like for the proponents of safer supply? Because we know they're flooding the streets with illegal pills. We know the overdoses are not going down. What's success?
Well, I do want to make a point of clarification here. So when it comes to the federal government providing exemptions, that is something which, from my understanding, and correct me if I'm wrong, is specific to supervised injection sites or consumption sites. And these are spaces where you get to use your own drugs.
No, the safer supply one is an exemption as well, and it's all funded. The programs are funded with federal money, straight out of Public Health Canada.
Yes and no. So, I mean, there are the federally funded programs which act as the foundation for safer supply, but also any provincial, any prescriber can prescribe safer supply drugs off-label because BC has essentially produced these clinical guidelines that provide them with legal cover, so they don't have to worry about being sued if they do this more or less. But that's complicated. Let's skip that. When it comes to measures of success, we have to remember that for many harm reduction advocates, they do not think that diversion is a significant issue because they have convinced themselves that it is safer to flood the streets with diverted pharmaceutical opioids because they believe that that will replace illicit substances that are riskier.
But why are the substances being diverted? It's because the people getting the prescription don't want the dillies; they want the fentanyl.
Yeah. Well, we basically put together the most irresponsible possible model of safer supply. We give out hydromorphone. It's as strong as heroin. Fentanyl is 50 times stronger than heroin. So if you are addicted to fentanyl, hydromorphone is not going to do it for you. It's not going to get you high. So for you to sell it on the streets is the reasonable thing to do. It's rational. You're making money to get your drug of choice. And because everyone else is making that exact same choice, our communities are being flooded with the drug and the drug becomes very cheap. But if you are getting 20 to 30 pills every single day and you are selling them for, 50 cents to $1 a pill, so, you can get between $500 to about $900 every single month, it's basically like an additional form of disability. I mean, honestly, it would be better for us just to hand them wads of cash than what we're doing right now.
No, because wads of cash would just let them buy their drug of choice and we wouldn't be flooding the streets. So the Trudeau government has tried to deny this. They denied it when you first started writing about it. They denied that it was happening in British Columbia when Global News went out on the streets and was buying them up for a buck a pill and showing that it still had the prescription label on it. Um, at what point do you think, or do you think they ever will admit, you know what, this isn't working out quite like we hoped?
I think that the federal government will never admit that there's a problem for two reasons. First of all, it would be politically disastrous for them to admit that their marquee addiction program has been so disastrous and has only exacerbated the problem and put opioids in the hands of kids. I mean, that will destroy them. And second of all, many of the people who are leading this file at the federal level are underqualified. Let's look at Minister Yara Sachs. She has no relevant qualifications here. She was a yoga teacher before she became Minister of Mental Health and Addiction. She claims to have, a nonprofit focused on mental health. When you go to the website, it's all based on mindfulness meditation. So it's the most, it's the breeziest and least substantial form of having a mental health.
Okay, but like, you don't have to get into credentialism to say, okay, you can read. You can look at the overdose death numbers. You can read the police report that says we seized 30,000 of these last year, or what was it, 10,000 in London, Ontario, in that one bust. She has to be able to read. They have to be able to see that it's not working. To me, it seems like it is just become a shibboleth of progressive politics that we always are more liberalizing in drug policy, never going back. It was a big move for British Columbia to move backwards on decriminalization. And I'm shocked that the Trudeau government finally gave in and allowed them to recriminalize in some instances, such as playgrounds and so on. They seem to, it just is a, put on the team jersey and do whatever your experts say. They seem beholden to experts that are activists more than medical experts.
Well, that's the thing, right? Is that, okay, going back to your thing on credentialism, I understand that we shouldn't just rely on credentialism, but she lacks credentials and curiosity. And those two things combined.
That's a deadly mix.
Yes.
I'll agree. A literally deadly mix in this case.
Yeah. And then on top of that, like when you have a minister who doesn't understand the issues very well, usually the deputy minister, so that's the head of the bureaucratic side of that ministry, has a lot of influence. So I kind of see her as being, I don't know, a bit of a puppet for these unelected public health bureaucrats who have very ideological perspectives on addiction policy, which I think is unfortunate. I think that it would have been much better if the Trudeau government had put in a different person to be minister. There's one guy who's on the health committee. I forgot his exact name, but he comes from a medical background. I think he worked in emergency medicine, and he understands that the evidence base for safer supply is very flawed. But for whatever reason, Sachs is minister and it's not working out really great. It's a problem.
Well, unfortunately, it's a problem that we won't be solving until there is an election and a change of government, it seems. Adam, thanks for the time.
Well, thanks for having me on the show again.
Drop a comment down below. Let us know what you think and share this on social media. Don't forget to subscribe to our YouTube channel.